Can you see those slides okay?
Yeah, I can see them, yeah.
Okay. I'll crack on, shall I?
Yeah, perfect.
Oh, brilliant. Well, thank you for joining the webinar today. My name's Louise Ratu. I'm a project manager for the Workforce and Education team at the Greater Manchester Cancer Alliance. I'm joined today by Tracy Cowburn, who's one of our cancer care coordinators on the pilot that I'll be discussing, and Samina Asif, who is the assistant project manager through this project as well. So I'm delighted to share today some of our results from the Cancer Care Coordinator pilot. So I'll be giving a little bit of a background about the project, some of the outcomes as well, and some of the results as well. Tracy will be giving an update from her Cancer Care Coordinator perspective, and I know she's got an absolutely fantastic case study to share as well. And then lastly, we'll be joined by Molly Pipping as well, who will give an update from the Greater Manchester Cancer Academy. About a personalised care education module that the Academy will be bringing out. So the project also has a very long fancy title called Developing a Model for Providing Integrated and Seamless Personalised Care to Patients with Life-Limiting Conditions, but more commonly known as the Cancer Care Coordinator Pilot. So this is a webinar. It will be recorded. However, please feel free to send out this link to your colleagues through your networks. We really want to get the word out about the Cancer Care Coordinator pilot as far and as wide as possible. So a little bit about the background about the project. To address the increasing number of cancer survivors requiring that follow-up monitoring and management, and to deliver outcomes mentioned in the NHS long-term plan ambitions to deliver more person-centred care and support the delivery of elements in the NHS comprehensive model of personalised care. Our project piloted 9 cancer care coordinators as a blended role between primary and secondary care within primary care networks across Greater Manchester, and therefore really growing our workforce in that priority area. This was an 18-month pilot initiated all the way back in April 2022, and it was a multi-partnership project with the Workforce Collaborative, Health Education England and Macmillan Cancer Support. The role aimed to be that real single point of contact for patients in primary care networks, conduct cancer care reviews, empowering patients to self-manage their own condition and provide seamless personalised care. For anyone who might not know what a cancer care review is, a cancer care review is a holistic conversation that takes place between a patient and a cancer care coordinator about their cancer pathway so far. A cancer care review can help patients to talk about their cancer experience and concerns, and then a cancer care coordinator can support patients to live well and beyond their cancer diagnosis through having supportive conversations and signposting patients to relevant services. Now, I'm quite a visual person, so here are the little characters to try and explain where the cancer care coordinators fit in. The cancer care coordinators sit within primary care networks, but they act as that connecting puzzle piece between primary and secondary care. As I mentioned, there were 9 cancer care coordinators across 9 primary care networks, and they were piloted in 2 in Bury, 2 in Salford, 2 in Stockport, 2 in Tameside, and 1 in Oldham North. So on to the interesting stuff. What's been the impact to date? Bear with me for a couple of minutes whilst the next section does get a little bit data heavy, but it's all really important numbers that have supported the project throughout. So 1,421 cancer care reviews were completed over the course of the pilot. That's an overall 17% increase in the total number of cancer care reviews as a result of the cancer care coordinators being in post. I think you'll agree this demonstrates a pretty huge impact on delivering personalised care, but also relieving pressure from GPs or other healthcare professionals who would have previously conducted those reviews. An interesting fact, the National Cancer Patient Experience Survey highlighted that only 23% of patients reported that they'd received a cancer care review in 2021. So it's really important that patients are having these standalone cancer care review appointments. Patient feedback also reflects the pilot in a really positive light. We received 241 patient responses through our patient feedback survey, and 98% of patients felt that the cancer care coordinator listened to what they had to say. And also, when I conducted one-to-one interviews with patients, one patient told me that the cancer care coordinator worded things in a very personal way, as opposed to that clinical approach that she'd been used to. We also saw an increase in workforce satisfaction as well. We sent out a workforce satisfaction survey. We had 35 people agreed that the cancer care coordinator reduces the workload, and 93% agreed that patients benefit from having a cancer care coordinator in the team. But I think our real selling point has been that although the cancer care coordinators have proven to have a short-term impact on reducing workload for staff and delivering cancer care reviews, the roles have definitely had a longer-term impact too. And we saw a 34% reduction in patient-initiated appointments with GPs 6 months after patients received a standalone appointment with a cancer care coordinator compared to when they had a cancer care review with a GP. This wasn't just true in Bury and Horizon, it was also true in Stockport and Oldham North, where we conducted a slightly deeper data dive. To put this into some monetary terms, that is approximately 507 appointments saved per PCN over the course of 12 months, an approximate time saving of 76 hours, and a potential cost saving of over £20,000 when this was averaged out across the 67 or what was 67 PCNs in Greater Manchester. So that's the data heavy section now. I'll go on to more case study work. So, what does this mean for the patient? Well, when we conducted quarterly audits against our Greater Manchester quality standards we developed, the reviews are really tailored to the patient's holistic needs, and patients' feedback demonstrate that they often go on to access groups in their community, including Macmillan Cancer Support and other support groups, meaning that patients aren't waiting as long for appointments, they're not being referred from pillar to post because their needs are being met during that cancer care review. The cancer care coordinators also pulled together a directory of contacts to improve communication between primary and secondary care to support them with this as well. In terms of training and education, we've had a comprehensive training package from the Greater Manchester Cancer Academy, and we have also been really fortunate to utilise the Macmillan Learning Hub as well to support cancer care coordinators in their role, and I know that they found the personalised care and support planning modules really useful too. We also used knowledge review surveys to assess how the cancer care coordinators felt about their understanding around different topics and their roles. And we were able to add any additional training that was required as well. And this included our collaboration with the Greater Manchester Screening and Immunisation team to develop new screening training, not just for the cancer care coordinators, but for Greater Manchester primary care teams too. In addition, I know the cancer care coordinators used their training and education grant from Macmillan as well, and they also had a monthly cancer care coordinator forum, which they used to problem solve as well. But I think it's safe to say that the roles have definitely evolved through the course of the 18-month pilot, and we've seen them expand. One of the cancer care coordinators in Tameside actively participated in an Answer Cancer screening event, which then subsequently led to engagement with the Possibilities Learning Disability Centre in Rochdale. Through collaboration, visual cancer screening materials were developed to enhance accessibility and inclusion for individuals with learning disabilities. The Cancer Care Coordinator in Oldham supported a comprehensive data analysis to understand the reasons for some patients not attending their breast screening appointments, and found that a lack of literature was a barrier for patients whose first language was not English. The Cancer Care Coordinator collaborated then with the Manchester Breast Screening Programme and the Public Health Service and circulated literature in multiple languages, resulting in an improved breast screening output among the targeted population from 48% in October 2022 to 62% in March. And again, very similar with Stockport, the Cancer Care Coordinator supported a survey to understand the barriers to cervical screening uptake. And the survey revealed challenges in booking or rearranging appointments for the working age population. And this, of course, then had a negative impact on the uptake of cervical smear testing. The survey then led to the introduction of an online booking portal, which improved efficiency and potentially detecting early cervical cancer, which is a really positive impact led service improvement led by the Cancer Care Coordinator. So I've discussed there the background and the outcomes from the project. I'll now just pass it over to Tracy, who's going to give her perspective as a cancer care coordinator working through the pilot. Over to you, Tracy.
Hi, thanks, Louise. Basically, my name's Tracy Coburn. I'm a Macmillan Cancer Care Coordinator based in Denton, Audenshaw and Drorsden PCN. The PCN covers 6 practices, and I joined the pilot early on in April 2022, and in October the end 23, the end of the pilot, I was retained by the PCN. My role, the core components of my role really are early diagnosis, promotion, and that's obviously within the community as well as the practices, national screening campaign uptake, and actually promoting uptake, whether that's again in the practices or out in the community with events, etc. Other than that, it's just really establishing sort of working protocols for better cancer patient care through the 6 practices, and making sure that there's an equality across all 6 practices, such as communication, contact, etc. And then the CAN 005 and CAN 004 QOF targets. Obviously the CAN 004 is the cancer care review. Could I have the next slide, please, Louise? And like Louise, I like my graphics. And this one really just exemplifies exactly what my role is as far as secondary care and primary care, and linking the 2 together for the cancer patient within the practice. So basically, early on, I decided to establish really good relationships with my secondary care teams and tertiary care teams, and that involved going out, you know, to them, introducing myself, introducing the new role, which is what it was at the time, and those links have proved invaluable going forward, because they really are what make this role tick when it comes to linking these 2 care teams together for the patient. So it just means that I'm now, I know exactly who I need to contact in which tumour site team is responsible for that patient in secondary care, whether that's the CNS, whether that's the consultant secretaries, whether that's the cancer care coordinators, whether that's the navigators. So it's just really linking everybody together. And now further along down the line in this role, I'm now getting that 2-way traffic back. So I've got CNSs, I've got navigators, I've got cancer care coordinators and secretaries contacting myself about a patient and the support needs, maybe when they're coming back into the community after their treatment plans have been consolidated. Then it's, Tracy, could you help? And I think that, you know, so all that early effort and all that early work early on is now starting to pay off, especially as far as the patient's concerned. So next slide, please, Louise. So this is a case study, and I really wanted to bring this to you all because I think that this is a really good example of how a cancer care review that's dedicated and structured can make a massive difference to the patient involved. So this lady, I contacted her via Accurix through EMIS, an invitation to attend her cancer care review with myself, and offered it either face-to-face at the practice or a home visit if that was appropriate, or by telephone. So really, you know, however she wanted to communicate, her preference was the priority. And as you see there, she'd been diagnosed grade 1 stage, so early stage endometrial cancer, and had had surgery and a short treatment plan before being discharged back to the community. I'd offered her if she wanted to attend, because she decided that she did want to attend face to face, and if she wanted to bring somebody with for support, and she decided that she'd like to bring her husband with. So I arranged to meet them at a convenient time at the practice. Can I have the next slide, please, Louise? So this review was probably about 45 minutes in total. And obviously I worked through the Macmillan template. So we go through all the template questions, and some of those are clinical. And if there is a clinical issue, then obviously I can signpost to the relevant clinician. So should that be a medication reviews needed, etc., I can task the pharmacist to contact the patient. So we work through the template, and basically the review of that conversation is listed here. So these were the issues that were important to the patient. There was an initial 4-month scan post-treatment plan that was overdue, and this was probably about 7 months now. So she was quite worried because obviously she hadn't had that initial follow-up scan. So that was outstanding. And there was also a pain clinic referral for management of her spinal issue and relevant pain that hadn't come through. So that was over 6 months she'd been waiting for that referral. And the PIP entitlement level had been reduced just prior to her surgery. So obviously there was a large amount of financial strain that had happened quite quickly after her diagnosis and surgery. So the mobility part of her package had been removed. So they had no vehicle. And this again had given them quite a few issues as far as attending appointments and even just doing the shopping. So there was a lot of the impact of the PIP reduction was really starting to tell on both of them. And the husband was having to do, obviously he had his own health issues, but he was having to do a lot of the day-to-day shopping, etc., that was needed, and was finding it very difficult without the use of a vehicle. So there was a lot of emotional stress there, and she was feeling very, very overwhelmed. And it was really quite this hopelessness that she had. It was really quite hard to watch, really. She was really struggling. And of course, because of the hypersensitivity and hyper awareness of her own body due to her cancer diagnosis, she was concerned about, there was certain nevi on her body that she was concerned about. So these were the things that she'd raised with me, and we looked to obviously try and resolve. Can I have the next slide, please, Louise? So the outcome was really quite positive on the whole, I would think. I liaised with the Macmillan CNS, again, just, going back to those relationships that I'd established early on. I was able to contact the Macmillan Gynae CNS straight away, and that the appointment was obtained. So the scan appointment was fixed. The pain management referral was actioned because I contacted the pain clinic direct, and we managed to get her an appointment within the next 6 weeks, I think it was. I then went to the Macmillan support and benefits team that are based at the hospital, and I raised this issue and was put through to the welfare office, the welfare officer rather, the Macmillan welfare officer, who we had a conversation about the DWP and perhaps reviewing her PIP. We managed to get that review, and I liaised with the team as to exactly what would be asked, so that I could relate that back to the patient. And the DWP got in touch with the patient, and we agreed. Initially they wanted a face-to-face, but because of her other health issues, we managed to get a video call, and I sat with her throughout that video call and advocated for her. And we had a successful reallocation of her previous PIP level, which meant mobility was reinstated. So they had a vehicle, and that has made, I think, above everything else, the most massive improvement to the quality of their lives. They're able to visit their two daughters who live quite far away. They're able to go shopping together. It really has improved the quality of their life. And as far as this hopelessness and being overwhelmed, I managed to get her a place on the Macmillan Hope programme, which she's benefited from immensely. And then obviously a GP appointment that was arranged just to get the dermatoscope overview of her issues, and which proved eventually that it was benign and everything was fine. So throughout this, obviously, there's a continued support and touching of base, and the communication is I think one of the most important things to establish and to maintain, because it's that reliability on you contacting them, keeping them updated. This is where we are, even if there's a delay, even if there's a bit of bad news as far as signposting is concerned and outcomes, even just keeping that communication level updated and intact is extremely important. So the next slide, please, Louise. And this is just some of the patient feedback that we've received over the last couple of years. I mean, obviously, I'd like to put everything up there, but I can't. But yeah, I mean, it's just things like you see there. A blue badge seems a very small thing in the bigger picture, but has eased what was a very stressful experience for both of us. And it is just something as small as that can make a huge difference when people are visiting various locations for treatment. And then, and the one on there down on the left hand side, after waiting over 3 years for some help with my problems, I think that for some cases, such as lymphoma, this is an ongoing issue of communication and just keeping people touching base every now and again. How are things going? Because issues can raise their head along it doesn't have to be an initial diagnosis issue. It can be two years down the line or 3 years down the line, and circumstances change. So I think it's just, you're there. I was once given an insight into my role when a patient said that you're the person that I call when I don't know who else to call. And I think that that's just something that's always stuck with me, that this is an ongoing relationship. It doesn't just finish with a cancer care review after 12 months. It's something that they can touch base with me, another 6 months or 12 months down the line, and family members too. It's when you get to know patients, you get to know their family members, such as the lady previous and her husband. I'm still in touch with them now and making sure that if they need any support or if things change, you're there. And that's really sort of like just an overview of the role, really. And I hope you've received something from it that's positive. Thank you.
Thanks so much, Tracy. You do that presentation so brilliantly. I think it's always so nice to hear a specific case study like that as well. It's so impactful. So thank you very much. We also do have a patient video to share about our patient talking about their experience with a cancer care coordinator, which we will embed in the slides when we send out. But really impactful. Thank you, Tracy, and thanks for coming on the call today and sharing your experiences.
Pleasure. Thank you.
So what's next? What's next for the pilot? We obviously want to share the pilot as far and as wide as possible. We don't want it just to be just Greater Manchester. We want to spread it across the UK, and we've done a lot of work already. We've presented at conferences. We have a podcast as well on the Greater Manchester Cancer Alliance Spotify account as well. You can access a podcast there. So we obviously just want to spread the word, please. So please, after this call, spread the word, send the link out to your colleagues and to your networks. I think the evidence is really there to support the roles going forwards, and we asked the primary care networks who were involved in the pilot right at the start to sustain the roles post-pilot through the additional roles reimbursement scheme, and we were pleased that all of the roles were sustained in each locality. We're also delighted that in Stockport they went one step further and have implemented cancer care coordinators in all of their primary care networks, which I think it really shows the impact that the 18 months has had on primary, secondary and community care systems. The next steps include obviously sharing our findings so far. So again, please tell your colleagues about the project. We also have an evaluation as well, which I can put a link in the chat, or Sophie, if it's easier, we can just send a link out through email afterwards. Hopefully this webinar will give you a good enough overview of the evaluation and of the project. We'd obviously love to recruit more cancer care coordinators, but we understand that there are financial pressures in the system at the moment. Therefore, we conducted some scoping to understand if there was some appetite to upskill care coordinators to have cancer as an element within their roles, and there definitely is that appetite there. So we hope to complete an education package, which I won't go into details now because we have Molly on the call to tell us more later, to upskill cancer care coordinators in cancer specific activities going forwards. We also recognise that there's different practices across the system, and we recognise that there's different skill mixes and workforce models. So the packages will be available and relevant for practice nurses or any other roles wishing to conduct personalised care in their roles. I think it's safe to say as well that the project was always going to be bigger than we originally planned as well. It was essential that we looked at the bigger picture as well to support all cancer support workers across the system. So we set up the Greater Manchester Cancer Support Worker Forum at pilot initiation to support shared learning and provide networking opportunities for all cancer support workers across Greater Manchester. We went one step further and we listened to what the workforce had to say, and we hosted our first Greater Manchester Macmillan Cancer Support Workforce event in October 2023 to support communication links and build bridges between primary and secondary care. We had over 80 people attend on the day, and we also had some really positive feedback from the event as well. To bring my section to a close then, before I pass on to Molly, we were absolutely delighted to finish the pilot, winning the Macmillan Quality Improvement Excellence Award in November 2023, which was really the icing on the cake, and it brought all of our hard work together. So we're really pleased to be awarded that. And here's some pictures of the team on the screen as well. I just wanted to finish off with some lovely patient feedback that we've had over the course of the pilot, and I think it really summarises what they think of the cancer care coordinators and the service that they received. All really, really positive, which you'll be able to pause this webinar and look at the feedback more as you please. But just wanted to finish off, if there are any questions, please do not hesitate to contact the Greater Manchester Cancer Workforce and Education team, and you'll be put through to somebody who's worked on the pilot to answer any questions or queries that you may have about the project. Thank you very much. I'll just pause there in case anybody's got any questions at all. If not, I will pass on to Molly.
Thanks, Lou. Let me share my screen. Very conscious that I've done one of these summits before, so I don't want to rehash stuff that we've gone through before. So today I'm just going to angle this in terms of what the Cancer Academy is doing really to support this pilot, and how cancer support workers, whether you work in primary or secondary care, can utilise the Cancer Academy in order to get the most out of your education, but also I suppose in terms of that wider picture, looking at the NHS long-term workforce plan, how we really support that. And I think it's a really nice way to bring this together as well. Another project that was funded by the Workforce Collaborative. So it really shows how different funding streams can also come together and fuse to design something really amazing. So just for anyone who's watching who isn't aware what the Cancer Academy is, We were established a couple of years ago now to support the development of a sustainable lifelong learning model for our workforce, and that was designed to meet the current and future needs of our population. I think that we're quite unique in that there are other academies and other education providers that exist, but we go across all different care settings and all different professional groupings. Our main focus is the non-medical workforce, but that doesn't mean that our medical workforce can't access our offers. We are all about making sure that we are equipping our workforce with the skills and tools necessary to deliver best patient care, and we aren't bound by traditional roles and remits of skills that sit within cancer services. As I've said already, we support the longer-term workforce plan and the NHS people plan as well. But I think one of the beauties of having an academy is that we can reduce inequity around access to cancer education, but also standardise those offerings. We so often hear about the postcode lottery, especially in areas such as Greater Manchester, where there can be such disparity between the levels of care and outcomes for cancer patients. It's really important that we can standardise that offer. And for us, everything that we do is driven by workforce need, and we don't want to tell you what we think you need to know. So we do a lot of scoping exercises to understand what people need to know about. We started out a couple of years ago, as I said, looking at phase 1, which was a pilot within the urology specialty for a variety of reasons. But we ended up coming up with what this model looks like here and creating our Hive of Cancer Education, which is our website. That's where you can find all of our quality assured CPD learning and also all of the other good stuff that we signpost out to as well. But we realised that this model was quite nimble, very transferable, and quite quickly we went from one cancer academy to 19 different ones. There's now one for every cancer pathway that we house at the Cancer Alliance. So you've got site-specific and haematology, and there's also some other cross-cutting ones such as personalised care. But we also support some of the fantastic work that the Children's and TYA cancer ODNs run as well. So I'll flash this up because this is a new slide. And again, obviously you can look back at this afterwards, but this is an example of what our work programme looks like. So this is everything that we will deliver through 24-25. So if there are any areas on here that you're looking at thinking, oh, I'd be really interested in knowing more about that, or I've got an offer that we could link in with, then please do get in touch with the team, because the majority of these are new pieces of work and things that we haven't got our teeth stuck into yet. And we're always open to collaborative working just to make sure that we can reduce that duplication and use our resource best across Greater Manchester. So looking at cancer support workers specifically, we've got some modules that sit on our website. I'll come back to the LGBT one in just a second, but we do have a package on foundations in psychological care, which is a rework of the package that's offered Psych Level 2 for our CNSs and specialist AHPs. So that was in high demand, so that is free at the point of access, as is all of our education for cancer support workers. You can also find on the other educational offerings page and the Personalised Care Academy page a comprehensive package that we pulled together, some of our own offers, others that we've signposted out to that are gold standard, that really support how to do a really good quality gold standard cancer care review or a holistic needs assessment. So I would also encourage people to go and have a look at that. We've got some webinars that are free, again, at the point of access and can be watched on demand, as with all of those site-specific events, and the cancer support worker one that Louise has already mentioned. You can go back and watch that too. But I think coming back to this one, the module that we've got on inclusive conversations and more empowering terminology, we've developed this in collaboration with the LGBT Foundation, and this actually came off the back of a scoping piece of work that we did at the Cancer Support Worker Forum. Nearly 200 people have completed this module already across Greater Manchester. And I think it's a great example of how we can take a piece of core training and make it specific to cancer, but equally you could lift and shift this to different care settings. And I know that the ICB have done some additional work that really complements this suite of activity. But I suppose just to give it that quality assurance stamp, the news has just been released that we've been shortlisted for a HSJ award. So a little bit of assurance there that we can't be far wrong from what we should be producing. And an exciting offer for any cancer support workers who would like to get involved in this. We're also piloting a new approach to communication skills training. We think that this will probably be pitched more at your specialist workforce, your CNS AHP levels, but given this is the pilot, we just want to make sure that we're testing the waters and casting the net as far and wide as possible. So we have opened this out to cancer support workers. We funded 200 free places across Greater Manchester. So if anyone is interested in getting a place on this, then you would have access to a 2-hour CPD accredited module, followed by access to the 2 simulations, where you get to meet Daniel and Susan, who are simulated digital humans. Daniel's just been diagnosed with a lung cancer, and you get to manage that conversation, breaking the bad news. And then you meet his wife, Susan, who's very angry, and it's about de-escalating that conversation and conflict resolution. So you can really practice those skills in a safe and controlled environment. And we do have some additional funding that we're drawing down from NHS England that will land in the next few months. So a real opportunity for us to further shape this pilot. So there are scenarios relevant to support workers. So the more people who can engage in it, the absolute better. And I suppose to wrap this up, I couldn't do a presentation talking about our workforce without mentioning Ascend. I think everyone or most people have heard of it now, but Ascend is the Aspirant Cancer Career Education Development Programme. And I suppose to summarise it nice and succinctly, it's an end-to-end career framework that not only supports the retention of our workforce, but it helps them highlight skills gaps. It might make them realise an area where they need to do some more development in. We're very keen that this isn't perceived as a tick box exercise, but it's very much there to enhance skill mix within teams and for people to progress within their careers. We have created an e-portfolio also where we secured funding from the Workforce Collaborative, where people can log their learning achievements against Ascend. So we're really supporting that implementation of this nationwide project. And also it will be quite iterative, and there will be some new elements that are added into it. I'm just going to stop sharing my screen and reshare it with sound so you can watch a very brief video on what the e-portfolio is. Because for us, I think the next steps are really around broadening that implementation piece. Obviously, in order to support that workforce retention element, we can only really do that if people are utilising the e-portfolio effectively. So hopefully this will share and you won't get an awful echo, which other people seem to get when I share this video.
Introducing the new Greater Manchester Cancer Academy e-portfolio platform. A brand new system designed to support you with your professional development. With the e-portfolio, you'll now be able to log your learning achievements and highlight development opportunities to progress with your career. You'll also be able to have more informed appraisal conversations, as well as support with revalidation. The e-portfolio is centred around the levels of practice in the Ascend framework: supportive, assistive, pre-registration, registration, enhanced, advanced, and consultant. We've also created the speciality-specific frameworks for each cancer pathway. So whatever level you're currently at, you'll have the resources you need to progress in the palm of your hand. Find out more and create your e-portfolio at gmcanceracademy.org.uk.
There will be an additional video available on the Cancer Academy website as well that gives you more of an insight in terms of what a good e-portfolio looks like and how to upload relevant evidence. But this is what it looks like when you log in, and the first time you access it, it'll ask you to select your level of practice against the Ascend framework. All the slides are going all over the show. And then you'll be able to log the learning as it describes in that video. All the domains that are in Ascend are there, and already in terms of site-specific variations, urology, colorectal and acute oncology are currently live. And I can't end an education session without flagging that the Greater Manchester Cancer Conference is back. It's not too far away now. It's the 14th and 15th of May. We would love to see our cancer support worker community there, so please do register. It's free. You can come for one day, both days, or you can also register to watch virtually if you can't get all the time out. And our awards evening is on the middle night, and entries for that have closed. However, if you've missed the boat on that one, but you do have a project or a service improvement piece of work that you've been getting involved in, then you can submit it for a poster abstract entry. And I don't think that closes until the 10th of April. So you've got a few more weeks to get those submitted. But I will leave it there. And if you want the latest updates in terms of all of the education that's available through the Cancer Alliance and the Academy, then these are our social media accounts. Thanks, Louise.
Thanks so much, Molly. Great to see all the work coming through the Cancer Academy there. And I have just posted a link as well, which is here from Janet. So it's all about a patient's experience with a cancer care coordinator as well. So we've covered quite a lot today. Thank you very much for listening through the webinar. We've covered the background around the cancer care coordinator pilot, our outcomes from the project, and we've also heard from a cancer care coordinator and Molly as well around the Cancer Academy. So thank you very much for listening. As I mentioned in my presentation, if there's any queries or questions, please do not hesitate to get in contact with us. We'll be more than happy to help. Thank you very much, and I'll pass back over to Sophie. Oh, you're on mute, Sophie, sorry.
Thanks. Thanks, Louise. Yeah, so I'll